Hello everyone, I am Shikaina Aquino Maranga from BSN 111A, and for today's video, I am going to perform assessment of the cranial nerves return demonstration. Cranial nerves examination provides information regarding the transmission of sensory and motor messages primarily to the head and neck. So before I entered my patient's room, first I have checked for the doctor's order. I have performed hand hygiene and of course prepared the necessary equipments that I'm going to use, which includes a pen light, a tongue depressor, a percussion hammer, a tuning fork, cotton balls, a cotton swab stick, a coffee and soap to test for patient's olfactory nerve, and some handheld cards to test for patient's optic nerve. Now, prior to the conduct of the procedure, first thing to do is to introduce self to the patient, verify patient's identity, and explain the procedure to the patient. Good morning, sir. I am Shikaina Maranga, your student nurse for today. And may I see your wristband, sir? Please state your complete name.
Richard Gomez.
And your birthday, please.
February 3, 1967.
Okay, so how would you like me to call you today, sir?
Richard.
Okay, Richard. So today we'll be assessing your cranial nerves. So I might have to ask you to stand up, to walk, to sit down, or to lie on the bed. Okay? I'll give you some set of instructions which I need you to follow. Will that be alright?
Okay.
Okay. Perform hand hygiene and observe appropriate infection prevention procedures to deter the spread of microorganisms. Now provide privacy for the patient. Sir, will it be alright if I close the door so no one from outside will be able to disturb you while we're doing the assessment?
Fine.
Okay. Alright, so Richard, before we begin, I'd just like to ask, do you feel any pain anywhere in your head or in your back or extremities?
No.
Okay, have you experienced losing consciousness? Have you fainted?
No.
How about muscle weakness?
No.
Okay, and lastly, have you had any problems with your senses? With your sense of smell, hearing, taste, sight?
No.
Okay. If the patient displays difficulty in speaking, then point to a common object inside the room and ask the patient to identify it. Okay, so Richard, can you please tell me what this thing I'm pointing to?
Fun.
Okay, and how about that one?
Books.
Okay, great. Now ask the patient to read some words and match the printed pictures to the written words. Okay, so Richard, I have here some pictures. I want you to tell me what this picture is and point to the corresponding letters written here, okay?
Okay.
Please tell me what this is.
Apple.
And this one, please.
Banana.
Okay, great. Now ask the patient to respond to some verbal commands. Okay, Richard, so can you please raise your right hand for me? Okay, you can put it back down. Now, using your left hand, I want you to point to your toes. Okay, great. Proceeding now to the assessment of patient's memory. There are 3 categories to be tested. First, for immediate recall. Okay, so now we'll be proceeding to testing your memory, okay? I'll give you a set of numbers. I need you to repeat after me, okay?
Okay.
7, 4, 3.
7, 4, 3.
Now, gradually increase the number of digits until patient can no longer repeat the sequence correctly. Okay, 7, 4, 3, 5.
7, 4, 3, 5.
7, 4, 3, 5, 6.
7, 4, 3, 5, 6.
Okay, 7, 4, 3, 5, 6, 7, 2.
7, 4, 3, 5, 6, 7, 2.
Okay. Now start again from a 3-digit number, but ask the patient to repeat the sequence backwards. Okay, sir, so I'm going to give you another set of numbers, but I want you to repeat it backwards. So when I say 7, 4, 3, you're gonna tell me 3, 4, 7. Okay?
Okay.
Okay, so let's begin. 5, 8, 4.
4, 8, 5.
Okay, 5, 8, 4, 3.
3, 4, 8, 5.
Okay, so 5, 8, 4, 3, 6.
6, 4, 5, 3, 8, 5.
Okay, so generally a patient can repeat a series of digits, 5 to 8 digits in sequence and 4 to 6 digits in reverse. Now, moving on, we are going to assess for patients' recent memory. So, ask the patient to recall a recent event of the day. Okay, so Richard, do you know where you are today?
Yes, I'm in the hospital
Okay, and can you tell me why you were brought here?
for medical checkup.
Okay. Now, ask the patient to recall information given earlier in the interview. Okay, so Richard, before we began this assessment, I believe I've introduced myself to you, right? So, can you tell me what my name is?
Shikaina Maranda.
Alright. Now, give the patient a 3-digit number. Ask the patient to repeat it. And later in the interview, ask the patient for these 3-digit numbers. Okay, so Richard, can you repeat after me? 7, 4, 3.
7, 4, 3.
Okay, so I want you to remember these digits. Later, I will ask you for these numbers, okay?
Okay.
Now, assess for patient's remote memory. Ask the patient to describe previous illness, surgery, or events that happened at least 5 years ago. So generally, remote memory remains intact until late in neurologic pathology and is least useful in assessing for acute neurologic problems. Okay, Richard, so can you tell me the date of your wedding?
July 25, 1996.
Okay, so can you describe what happened that day for me, please?
That was my most happiest moment in my life.
Okay, can you tell me where you held the wedding?
At the First Progressville Church, Lopicina Street, Davao City.
Okay, great. So in assessing for memory, be sure that you also know the answers to your question. If not, then verify the information with the patient's spouse or relatives. Okay, so moving on, I am going to assess for patients' attention span and calculation. To test for patients' concentration and attention span, ask the patient to count backwards starting from 100, and to assess for patient's calculation, ask the patient to subtract 3 progressively from 100. Okay, sir, so we'll be assessing for your attention span. I want you to count backwards starting from 100.
Okay.
Okay, begin now, please.
100, 99, 98, 97, 96, 95, 94, 93, 92, 91, 90, 89, 88, 87, 86, 85.
Okay, that is enough. Now, I want you to subtract 3 from 100, please.
100, 97, 94, 91, 89, 86.
Okay, that is enough. Now, moving on to assessing patients' level of consciousness by applying the Glasgow Coma Scale. So, The Glasgow Coma Scale has three major areas, which is the eye response, verbal response, and motor response. So for eye response, I am going to grade my patient 4, which means spontaneous. As soon as I entered the room, patient is able to open his eyes. Okay, so verbal response, I'm going to grade him with 5, which means patient is oriented to time, place, and person, as evidenced by his answers during our interview a while ago. Okay, and then lastly, for motor response, I'm going to grade my patient with 6 because he is able to perform the given commands. Okay, so total score is 15. Patient is awake and alert. Okay, so now we are going to assess for patients reflexes. Okay, so reflexes is an innate, immediate, and involuntary response to a stimulus without prior conscious thought. So we are going to assess reflexes using a percussion hammer and evaluate the symmetry of response. Now, there are a lot of areas in which we could assess and percuss for reflexes. We have the tendon reflexes, which includes the biceps, brachioradialis reflex. We have the triceps, patellar, and Achilles reflexes. We also have superficial reflexes, which is a motor response to scrapings on the skin. This includes abdominal reflex, cremasteric reflex in males, and also plantar reflex. So for today's video, I am only going to demonstrate the plantar or Babinski reflex. Okay. So sir, we are going to be assessing for your plantar reflex. I want you to move back, please. Okay. Now, using the handle of the percussion hammer, I am going to stroke the lateral border of the patient's foot, starting from the heel, going upwards to the ball of the foot, and then proceeding to the big toe. Okay, the other foot, please. Okay. So, a normal or negative response to Babinski reflex test is when the toes of the patient will bend downwards, and an abnormal or positive Babinski reflex test is when the toes of the patient will bend outward with the big toe moving upward. Okay, so proceeding now to the assessment of patient's motor functions. First, for gross motor and balance. Okay, sir, can you please stand? Okay. Now, first test we will be doing is the walking gait test. So what I want you to do is just to walk across this room and back here.
Okay.
Okay. Can begin now. Alright, so gait is the pattern of limb movement made during locomotion. So, while the patient is walking, observe for patient's posture, balance, and swaying of hands and leg movements. Okay, next we are going to be performing the Rombergs test. Okay, so stand straight, feet close together, please. Arms on the side. Rombergs test is done to evaluate patient's sense of positioning or proprioception. Okay, I want you to close your eyes, please, and remain in this position. Okay, so in doing this test, be sure to stand close to the patient to prevent patient from falling and avoiding injuries. Okay, you can open your eyes now, sir. Now, a normal finding for this test is when the patient only has minimal swaying and the patient is able to maintain a stable position with either eyes closed or open. Okay, so now we are going to perform the standing on one foot with eyes closed. Okay, sir, so we're going to perform the standing on one foot with eyes closed. I want you to place your hand on your hips, raise your foot. Okay, and try to maintain this position with eyes closed, please. Okay, down. The other foot, please. Raise your other foot. Okay. So, a normal person can maintain this position for at least 5 seconds. Now we are going to perform the heel-toe walking. Okay, sir? So, for heel-toe walking, what I want you to do is just to walk in a straight path. First, placing your heel directly in front of your toes, like this. Okay, like this. Okay, you can begin now. So, heel-toe walking, also known as tandem walking, demonstrates the cerebellar functioning and position sense of patient. So, normally a person should be able to maintain walking in a straight line. Now, we are going to perform the toe or heel walking. So, for this test, sir, I want you to walk in a straight line using your toes like this first. And then back using your heels.
Okay.
Okay. You can begin now. So, toe walking is the best way to test for foot plantar flexion, and heel walking is the best or most sensitive way to assess for foot dorsiflexion weakness. Okay, so moving on, we are going to be assessing for patients' fine motor in the upper extremities. You can sit back down now, sir. Okay, so first, we are going to perform the finger to nose test. What I want you to do is to abduct your arm, stand it, okay, shoulder level. Now I want you to use your index fingers and touch your nose like this, alternately, please. Okay. Now, I want you to do this with your eyes closed, okay? Okay. So, patient is able to do this test repeatedly and rhythmically. So, if the patient is unable to do this, or if the patient misses the nose and gives a slow response, this may indicate hypermetria, which is a potential cerebral disorder. Okay, so now we are going to perform the alternating supination and pronation of the hands on knees. So, sure, what I want you to do is to pat your knees like this, using the palmar surface of your hand, and then using the back of your hand, like this, alternating. Okay? Faster, please. Okay, faster. Okay, that is enough. Okay, so if the patient is unable to do, or is having a difficulty doing the alternation of the supination and pronation of the hands, this may indicate dysdiadochokinesia, which is cerebellar ataxia, which means this is an impaired ability to perform rapid alternating movements. Okay, next thing to do is to finger to nose to the nurse's finger. Okay, sir? So what I want you to do is to touch your nose first, and then touch my finger. Okay?
Okay.
Okay. Okay. Okay. So if patient misses the nurse's finger, then this may indicate dysmetria, which is a cerebral potential cerebral disorder. Okay, so now we are going to do the fingers to fingers test. I want you to extend your arms, shoulder level, and then bring your fingers together midline. Okay, again. I want you to do this with your eyes closed, please. Okay, that is enough, sir. Great. So if patient misses the fingers or is unable to do this test, this may indicate hypermetria. Okay, so next thing to do is to fingers to thumb on the same hand test. So I want you to touch all your fingers with your thumb like this. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. Faster, please. Okay, the other hand, please. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. Okay, great. So if patient is unable to do this, this may indicate dysmetria. Okay, so we are going to proceed to fine motor tests on patient's lower extremities. So, sir, I want you to lie on your back, please. Okay, thank you. So now we are going to perform the heel down to the opposite shin test. So in this test, we could do it either with patient lying or sitting. Okay, sir, so what I need you to do is to place the heel of one of your foot directly above or directly below the knees of the other foot, okay? Yes, like that, and stroke your shin down. Okay, now the other foot, please. I am observing for any tremors or awkwardness, or if the foot will move down the shin. Okay, so if patient is unable to do this test, this will indicate dysmetria. Now, performing the toe or ball of the foot to the nurse's finger. Okay, so sir, I am going to place my finger here. I want you to move the big toe of your foot and touch my finger, please. Okay, and then the other one, please. Okay, great. Okay, so you can sit back up again. Okay. So now we are going to proceed to light touch examination. So, sir, we are going to do the light touch examination now. So, I want you to say, close your eyes and then say yes or no whenever you feel the cotton touching your skin, okay?
Okay.
Please close your eyes.
Okay. 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 Okay.
Alright, great. So, for light touch palpation, light touch examination, an abnormal finding would be anesthesia, hypoesthesia, hyperesthesia, and paraesthesia. Now, if an area of sensory dysfunction is found, then determine the boundaries of sensation by testing the response every 2.5 centimeters in that area. Okay, so now we are going to perform the pain sensation test. Okay, sir, so I want you to close your eyes. Now, using this stick, I want you to tell me whenever you feel the sharp end or the dull end of this stick touching your skin, okay?
Okay. Sharp. Dull. Dull. sharp.
Okay. You can open your eyes now. So, alternate the use of the sharp and dull ends of the stick, and also allow 2 seconds in between each test to prevent summation of effects of the stimuli. Okay, so now we are going to perform the position or kinesthetic sensation. Okay, so sir, please give me your hand. I want you to tell me if I'm moving your finger upwards or downwards, please. Please close your eyes.
Up, up, down, up,
Okay. The other one, please.
up, down, down, up.
Okay. So, if the inability to determine the direction of movement may be seen in posterior column disease and peripheral neuropathy. So, now we are going to proceed to the assessment of the 12 cranial nerves. Okay, so first we are going to assess for cranial nerve number 1, which is the olfactory nerve. Okay, so first ask the patient to clear out his nose to remove any mucus. Sir, can you please clear out your nose? Okay, here. Thank you. And then ask the patient to close his eyes, occlude one nostril, and ask the patient to identify the object that I'm going to let him smell. Okay, so sir, we are going to test for your sense of smell. I want you to close your eyes. I'm going to cover one of your nostrils, and please identify this object or this scent.
Coffee.
Okay, great. So please remain your eyes closed. I am going to use another object for the other nostril.
Soft.
Okay, great. You can open your eyes now. So next would be assessing for patients cranial nerve number 2, which is the optic nerve. So first we are going to assess for patients visual acuity. Visual acuity is the degree of detail that the eye can discern in an image. So for this test, we are going to use a handheld card and ask the patient to read what is written in the handheld card. Okay, sir, do you use eyeglasses or contact lenses?
No.
I want you to read these numbers for me, please.
1, 2, 8, 7, 3, 6, 5, 8, 2.
Okay, great. Now, we are going to assess for patients visual field. Okay, visual field is the total area in which an object can be seen in the peripheral vision with the eyes focused at a central point. Okay, sir, so I want you to look at me straight in the eye. Okay, so I'm going to place my fingers here. Tell me whenever you see them entering your visual field. Okay?
Okay. 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 Okay.
Okay. Now, we're going to assess for cranial nerves number 3, 4, and 6. This oculomotor, trochlear, and abducens. These three are all motor nerves. So, oculomotor is responsible for eye movement, upper eyelids, and the constriction of pupils. Now, trochlear is responsible for the movement of superior oblique muscle, and the abducens is responsible for the movement of the lateral rectus muscle. Okay, so to assess for these, ask the patient to look directly at the eye. Sir, I want you to look at my eye. Okay, so I am inspecting the upper eyelids. Upper eyelids should not obscure vision. Okay, observing for pupils. Pupils should be round and equal in size. Now, Assess for pupillary reaction. Okay, observe for the direct and consensual response. Okay, sir, so I'm going to shine a light on your eyes, okay? Just look straight into my eyes. Okay, great. So next, I am going to hold out my finger like this. I want you to look at my finger and then to that spot on the wall, please, okay? Look at my finger first, and then the spot on the wall, please. Finger and the wall. Great. Now we are going to perform the cardinal fields of gaze test, which is a test done to evaluate the 6 extraocular muscles and cranial nerves 3, 4, and 6. So, okay, sir, so I want you to follow my finger using your eyes only. Do not move your neck, just your eyes, okay? Okay. Okay. Pupils are equally round, reactive to light, and accommodation. So next, we are going to be assessing for cranial nerve number 5, which is the trigeminal nerve. Trigeminal nerve is both a sensory and motor nerve, which innervates all the muscles of mastication and mediates facial sensation. And the sensory part of the corneal reflex. Okay, so the mandibular, maxillary, and ophthalmic divisions should be tested symmetrically. First, for pain. Okay, sir, so we're now on the assessment of your cranial nerve number 5. I'm going to assess for pain. Okay, so I'm going to use a broken cotton swab stick to poke you. I want you to determine or tell me whenever you feel the sharp end or the dull end of the stick. Okay?
Okay.
Please close your eyes.
Sharp. Dull. Dull. Sharp.
Okay. So, I am going to compare both sides. So, I want you to tell me if the feeling is the same or not. Okay? Please close your eyes. Is this the same with this?
Yes.
Is this the same with this?
Yes.
Okay. Now, for light touch sensation, I am going to use a cotton. I want you to close your eyes and say now whenever you feel the cotton touching your skin. Okay?
Okay. Now.
Okay, so now I'm going to compare both sides. I want you to tell me if the feeling is the same or not.
Okay.
Okay, so is this the same with this?
Yes.
Is this the same with this?
No.
Okay. Now, moving on, we are going to test for your corneal reflex. I want you to look up and to that side. No, with your eyes only, do not move your neck. Look up and to that side, please. Now, approach the patient on his side, away from his line of vision, and then lightly touch the cornea. Okay. Now, I want you to look up and to that side, please. Alright. So, a normal patient would blink and tear in this corneal reflex test. Okay, so moving on, we are going to assess for cranial nerve number 7, which is the facial nerve. Facial nerve is both a sensory and motor nerve responsible, or which innervates all the muscles of facial movement and expression. Also mediates taste sensation in the anterior 2/3 of the tongue. Okay, sir. So I need you now to do to perform some facial expressions. Okay. Can you please smile? I want you to frown. Now show your teeth. Okay, now puff your cheeks. Okay, relax your face. Purse your lips. Alright, now I want you to close your eyes tightly that I can open it. Okay? Okay. So normally a person can do these maneuvers easily. Okay, next would be to assess for patient's cranial nerve number 8, which is the acoustic or vestibulocochlear nerve. This is a sensory nerve which mediates hearing and balance. So first we're going to perform the whisper test. Okay, so sir, we're going to assess now your hearing. We're going to perform whisper test. I want you to close your eyes. I am going to cover one of your ears and whisper something on the other side. I want you to repeat it loud, okay?
Okay.
Okay, so in doing this test, be sure to conceal your mouth to avoid lip reading. Okay, and whisper words such as 99 or baseball. Okay.
99.
Okay, now your other ear.
Baseball.
Okay, great. Now we are going to perform the Weber's test. Okay, using a tuning fork. We are going to place it in the patient's head. Okay, do you hear that sound?
Okay.
Is it louder in one ear or just the same?
The same.
Great. Now, we are going to perform the Renee's test to assess for air and bone conduction. So, place the vibrating tuning fork in the patient's mastoid process behind the ear. Okay, do you hear that sound?
Okay.
Tell me when it stops.
Okay.
Right, do you hear it now?
Okay.
Tell me when it stops, please.
Okay.
Okay, so normally a patient could hear the sound longer in air than in the bone. Next, we are going to assess for cranial nerve number 9 and 10, which is the glossopharyngeal and the vagus nerve. Both is responsible for the motor and sensory part of the palate, pharynx, and larynx. Okay, so sir, I'm going to assess the insides of your mouth. Okay. I want you to say ah. Okay, assess the sound of the patient's voice. Is it hoarse or does it have an nasal quality? Assess the palate, the soft palate, and the uvula. Okay, you can close your mouth for now, please. So, the soft, you should see the soft palate rise promptly and symmetrically, while the uvula should be midline, should be in the midline. Now, we are going to test for the patient's gag reflex. Okay, sir, we are going to test for your gag reflex. I'll be poking the back of your throat, okay, for you to gag, okay?
Okay.
Please open your mouth. Okay, sorry. I'm really sorry. Sorry. Okay, please open your mouth. I need to do it again on the other side. Okay. So, in this test, you should see the soft palate rise and other signs of gagging. So next, we are going to assess for the cranial nerve number 11, which is the accessory nerve. Accessory nerve is a motor nerve which is responsible for the movement of the trapezius and sternocleidomastoid muscle, which in turn moves the head and neck. Okay, sir. So I'm really sorry for that a while ago. We are going to assess now for your trapezius and sternocleidomastoid muscle. Okay. First, we have to expose the trapezius muscle. Can you please shrug your shoulders? Okay. Hold it, please. Okay, down. Assess for the strength and the contraction. Now, sir, I want you to move your head against my hand, please. Okay. Alright, now the other side, please. Okay. Assess for the force and contraction of the sternocleidomastoid muscle. Now, we are going to proceed to the assessment of the 12th cranial nerve, which is the hypoglossal nerve. It is a motor nerve that is responsible for the muscles of the tongue, which affects the articulation of words. Okay, so we are going to assess for your tongue, sir. Can you please open your mouth? Okay. Okay, you could close it for now. Assess for any atrophy or fasciculations in the tongue. Now, please stick out your tongue, please. Okay. Observe for any asymmetry or deviations from midline. Alright, you can close it now. Thank you. So, the tongue should be protruding outward. Okay. Should be protruding outward. So, that ends our cranial nerve examination. Of course, after doing all the tests, we should summarize the information to the patient, perform aftercare of the equipment, perform hand hygiene, and document the findings of this procedure.